This conference will now be recorded.
Hello again, and thank you for tuning in to the different modules that you've watched up to this point. Today, what we're going to do now is we're going to dive into the underwriting aspect of your job and ultimately what is going to be expected of you. First things first, if you followed the script along the way that we have taught you, the way that we've gone through in a previous module, you'll know that there's a portion of the script where you have to start to ask them about previous and current medical conditions. And if you paid attention, you know by this point in time, there's a distinct difference between what is considered chronic and what is considered acute. And as a refresher, acute is something that's situational, like a heart attack or a stroke, um, pneumonia. Those are acute conditions. And chronic is something that you manage on an everyday, ongoing basis, such as diabetes or atrial fibrillation, AFib. Those are what are considered chronic conditions. And so, the very first thing you want to do after you ask all the different conditions is you want to go into the very quick underwriting guide that everyone is provided. And first things first, you should have already at this point in time checked their height and weight against the height and weight chart. And so, for example, we'll pretend this is a 5'5" person at 200 pounds. When you go and look at the height and weight chart at 5'5", and you look across the board, no one is going to be declined at 200 pounds. There is one carrier that we work with, Royal Neighbors. They do not abide by a height weight chart. It's just Liberty Bankers, Americo, and Prosperity. So first things first is you want to definitely look at the height weight chart. Second thing is you want to quickly look at the underwriting guide that we put together. This is just meant for a very quick, glancy guide. And we'll assume this person told you that they had a stroke 5 years ago. And you don't know, you don't recall how the insurance companies will look at stroke. So you're going to go down to the stroke section, and they told you the stroke was 5 years ago. And when you look at the stroke section, when you take a look and see, you're going to notice that as long as the stroke was after 2 years, down over here, green means go. All of our carriers will accept somebody that has had a stroke. If they told you they had a stroke within the last 2 years, you got to ask a bit more questions. This carrier will be good if it's over 1 year but less than 2. This carrier will be good if it was over 18 months. So if they tell you it's been less than 2 years, you have to dial in and ask the date. Okay? So when it comes to situational things, you always want to ask the date. Heart attack, their last cancer treatment or infusion, when the doctor declared them cancer free, when they had their stroke, the last time they were hospitalized. You want to know dates. Now, not everybody is going to be clear on the actual month and day, and you want to try to help them jog their memory by asking things like, was it before Christmas? Do you remember? Do you remember what holiday it was around? And you help them jog their memory, but you want to be as close to the date as possible, especially when you're close within whether or not they would be approved, preferred, declined outright, or modified. So very, very important. So once you look that up, situational things, okay, and even how the insurance companies look at the chronic stuff, okay. Chronic illness would be diabetes, okay. See, there's a lot of green there. The next thing you want to do is you want to start to build the best plan pro. And so we'll start with their date of birth, and we'll make this person 69. And we said we were going to do somebody 5'5", 200 pounds. We'll make it a male. We'll use the state that we're in now. And then I'm just going to put in $10,000, for example. Now, the person told me they had a stroke Okay, and obviously I spelt it wrong, but they told me they had a stroke. Okay, and there's two kinds of strokes. There's a CVA and a TIA. A TIA is a mini stroke. When somebody tells you they've had a stroke, it's always going to be CVA. And over here, it tells you what the diagnosis criteria is. But we already know that because you looked at the quick reference underwriting manual. And you know that somebody who had a stroke 5 years ago is good to go for all our carriers. But we're going to make sure. Over here, when you put in the condition, and it's a single event condition, you want to pay very attention to this one right here, the last treatment and then the first diagnosis. Obviously, if it was a stroke, the stroke happened at one time. The person told you it was 5 years ago. Both dates should match. Okay? I had a stroke. It wasn't a TIA. It was 5 years ago. It was a single event. Both dates must match. And you hit save. They also told you that they're managing diabetes. Okay? All right? Diabetes over here. And they've been managing diabetes for 4 years. So here, because diabetes is a chronic condition, not an acute condition, it wasn't a single one-time event, the last treatment is more often going to be now or today. Okay? So be very cognizant when you're putting in a condition. Very, very, very important to pay attention to the last treatment and the first diagnosis. Now, if you ask the people these questions, they're not going to really know. They don't remember. A lot of people don't remember. But when you're dealing with single event situations, heart attack, stroke, cancer, if they've been hospitalized, if they've had surgery, things that happen generally one time. You want to be very clear that the first diagnosis and the last treatment dates are going to be the same, and it was for when the event happened. The other thing you can do with the tool is you want to add in their medications. Now, this particular individual told you that they're on furosemide. First thing you want to do, and I should have said this before, is you want to go and look up what that drug is for. Okay, so let me get this out of the way. Okay, so you want to look up what furosemide is for. Okay, more often than not, they'll know what it is, but you always want to look up the medications. And over here on the right-hand side, it'll tell you what the name brand is. Oops, sorry about that. It'll tell you what the name brand is right here. And oftentimes, when the person goes and grabs their medicine and they tell you they're on furosemide, and they'll probably spell it for you, they may not remember what it's for because they might be on some other medications for their heart, and they're not sure which one's high blood pressure or which one's this or which one's depression. So they get a bit confused. So when you can tell them, oh, the name brand of that medication is Lasix, they'll say, oh, yeah, that's right. I take that for high blood pressure. Okay, I just want to confirm because it's typically used to treat edema or congestive heart failure or liver disease. Are you sure that you take it for high blood pressure? Yes, I do. Okay, wonderful. And here's why. Here's why you always want to confirm that. When you look at a particular insurance company's underwriting manual for their medications, oftentimes a medication will have more than one use. So our topic right now is furosemide. And if you take a look at this particular insurance company, furosemide could be used for both congestive heart failure, which is pretty serious. It's water around the heart. It means the heart's not pumping strong enough. And generally with a CHF, your lifespan is not that long. Or the other reason is the reason they told you, which is hypertension, high blood pressure. And if you take a look here, if they take it for congestive heart failure, this insurance company will modify them. No death benefit for 2 years. Return of premium, 110%. However, if it's for hypertension, the insurance company will offer them level rates. So it's very important to know why they take the medication, okay? Always want to type it in. It tells you exactly what it's for. You can confirm. You can mention the brand names. And oftentimes medications can be used for two reasons. Now you got the medication in, okay? Furosemide comes up. It'll show you all the different reasons here that this software will analyze that medication. So if the person takes furosemide for any reason not listed here, any of these reasons here, if it's not listed, this software program will not take into account the use of that medication. So it's very, very, very important that you know exactly what the medications are used for. In this case, we know it's high blood pressure. Okay, so I start to type it in. The next thing you want to know is the dosage. Sometimes the dosage will dictate what it's used for. This particular medication, the higher the dose, the more serious of the use. So if the person is taking Lasix, furosemide, and they tell you they're taking 80 milligrams, well, guess what? It's not for high blood pressure. Okay, it's for congestive heart failure. So very, very important we know the milligrams and the dosage, and then also how long have they been taking it for. Now, you don't want to dial it down to the exact day because, again, most people are not going to remember this. You want to ask questions like, how long do you think you've been on it for? And they may say something like, I don't know, 3 years, maybe 4 years. Then you can go back in time and say, okay, is it your belief that you've been on this medication since 2015? Right around then, or 2014? And they'll say, well, I don't remember. And then you might want to say, well, was Obama in president? Was Barack Obama the president at the time? Yeah, he was. Okay, great. So it probably was 14 or 15. So you would put in the dates. Now, obviously, if they're currently taking it, you just leave the most recent date the same. And you go ahead and save it. And look what happens. Right over here, a condition appears. The condition that you put it in for. That little star there, if you can see it, the star right here, means that we need to do something with the condition. Because look, if we go to analyze, it'll say, please click on each condition with a star to confirm dates before analyzing data. So here, we want to make sure that the high blood pressure in this example is controlled. Obviously, uncontrolled would be a problem. And then we want to make sure the dates are right. Remember, the medication, when attached to a condition, will trigger a condition. If this was a condition that was a single event, we would not want the last treatment to be today. If it was a single event, we would want the last treatment to be a long time ago. And I'm going to show you an example of that. So you go ahead and hit save. Okay. You click analyze. And then what will happen is the various different insurance companies we work with will pop up. And it looks like this person would be eligible for Liberty Bankers, Royal Neighbors, Prosperity, and American Eagle. Okay, we know AIG is guaranteed issue. So where we want you to lead first with Royal Neighbors of America, second with Americo, thirdly with Liberty Bankers, and fourthly with Prosperity, you would be recommending Royal Neighbors in this example. Now, what happens if the stroke was a little bit more than a year ago? Okay, it happened in May of 2018. So remember, single events, dates got to be the same. What will happen now to the system? Remember, less than 2 years, more than 1. Now when we take a look, we see that Prosperity will modify them. AIG still guarantee issue. Royal Neighbors is a straight decline. It's just excluded. You can't even quote them. Liberty Bankers is modified, and we have Americo Eagle level. So again, when you're dealing with a condition, you want to be real clear when the first diagnosis and last treatment happened. Typically, where you would see these dates differently in the past would be in the event that there's a cancer diagnosis. Okay, so you would put cancer. Okay, and the person may have gotten cancer in 2010, and they may have had cancer for 3 years. Okay, that would be the only time you would have different dates in the past. Would generally be a cancer diagnosis, um, because that's the only type of condition that could be eventful and in the past and last over a couple of period of days. Now remember, um, the stroke is what caused this particular client to do Americo Eagle Premier. If we take the stroke out, look what happens. All the carriers are back again. So when you're quoting your metallic levels, your gold, your silver, your bronze, your platinum, if the $10,000 amount happens to be your silver quote, with this particular example, you would quote this person for silver. You would write it down. You would write down 7161 for silver. You would go to 12,000 for gold. So the person's gold quote for 12,000 would be 8541. You would go to 8,000 for bronze. So their bronze quote would be 5781, and then you jump up high for their platinum. Okay? The reason we do platinum, just so everybody knows, is because you never know what kind of buyer you have on the phone. You have no idea what kind of buyer they are. They may get the quotes from you and realize that $71 a month was not nearly as high as they thought $10,000 of coverage would be. So they would be willing to go up higher. So by giving them a much higher value, you do one of two things psychologically. You either pull them up to that higher amount if they thought what you gave them was not that much, or you push them down to the plan that you want or you suggest is in their best interest because they feel that that higher amount is way too much. So for the 15,000, I would be quoting this person 106.11. Okay. America Eagle is a little bit higher than 106.11, and remember, we want to lead with Royal Neighbors. It's just an easier and quicker application process. So just to kind of recap, step one is to look at the height and weight chart and make sure that they're not out of the parameters. If you have somebody that's 5'8" and they're 310 pounds, we know that the only carriers that we're really looking at is going to be Prosperity Graded, Liberty Bankers Modified, Liberty Bankers Standard. Okay, and Standard is just as good as Preferred. It's just a little bit more expensive. And then we know that Americo is out. So basically, quickly looking at the height and weight, I can eliminate even looking at two insurance companies. I don't even have to bother with two insurance companies because they're out. Okay. The next thing you want to do is you want to quickly look at the cheat sheet that we gave you. Green is good, purple is not bad, and red is dead. Okay. You want to quickly look. The person tells you they're bipolar. You quickly look. You know that you want to work with the greens first before you work with the purple. If the person tells you that they are dealing with depression, we know that we're working with greens. Okay. Very important to quickly look at this. Very, very, very important. If somebody tells you that they have a felony conviction, you know that three carriers don't care. Liberty Bankers does if it was 2 years ago. Okay, so very, very quickly you would look at this. Then you want to plug everything into the system, as I showed you, and you want to analyze the report. Again, remember, you want to make sure you have the length of time they were prescribed the medication, what the reason it's for, and then make sure with your conditions you have them set right. Okay, if it's chronic when they first started, if it's acute, situational, when it started and when it ended. And oftentimes it's on the same day. If they had a heart attack, the heart attack started and ended on the same day. Okay? Very important to do that. I would suggest that you take your time with this tool. Always, 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 always look up the medications on the internet, no matter what. Okay. Always, always, always look it up. And it'll always tell you the name brand, the generic, which is warfarin in this case, and a blood thinner, what it's for. Okay. Very, very important. So the more time you spend on the underwriting, the deeper relationship you will have with your prospect. And the deeper relationship you have, the more they're going to trust you. The more they're going to trust you, the more apt they're going to be willing to do business with you. So the key is in the underwriting. Get out there, take your time, ask questions, don't assume, and you will all do well.